The board is established now, and we have our CEO, as I have announced today. And we have already started, and the foundation have already started taking the next steps, meaning raising the funding as operational cost for the foundation. And while raising that funding, of course, it will trigger the ambitious 3 years plan the foundation has. So while the immediate funding will be the 40 million US dollars for the operation of the foundation, and then the plan is to mobilize $1 billion US dollars in the next 3 years. Thank you.
Thank you.
If I could just add, and this is more aspirational in terms of the foundation, because I've had the great pleasure of working on behalf of Dr. Tedros on the Solidarity Fund for COVID-19, which is a sort of precursor in a way of some of the hopes that we have for the foundation. And what it's been very, very empowering this year to see how funding coming from sources other than traditional have funded so many amazing efforts in terms of the Solidarity Fund that's invested in youth organizations for COVID-19 messaging, that's invested in oxygen solutions, in emergency medical team training and sub-regional centers in Ethiopia. It's involved funding our partners outside WHO more than our partners inside, including UNICEF, the World Food Programme, UNRWA, UNHCR and others who are doing health-related activities in the field. So it is our hope, Dr. Tedros, that the foundation will be, as you have laid out, a way in which WHO can leverage increased investment in health. And I think Tedros always says that this isn't about necessarily just increased investment in WHO. It's about leveraging more funding into the global cycle for health and driving partnership and innovation throughout the world. And I think we've started well with the Solidarity Fund, and we hope that the foundation will have that same impact, and I'm sure it will.
Thank you, Mike. You have reminded me actually one thing. When we propose this strategic solution for WHO, it's not just to raise funding only. It could improve the amount of funding, it could improve the quality of funding, that's one. But at the same time, broadening our base and moving into additional resources, which doesn't have any strings attached, means improving also WHO's independence. So it's not about funding only; it's also an independence issue. With long-term, multi-year, broad-based funding comes independence also. So it's not just finance; it's also ensuring and securing the independence of the organization, and that's why I said this is a strategic solution that addresses some of the systemic problems that we have. Thank you.